Orthopedics, the spine. Calcification seen on CT ligament. So we can do an incident CT of the spine and may see calcification or abdominal aorta. That may be the cause of the pain. Ankylosing spondylitis, severe deformity of the neck, can't look up and out. May need corrective osteotomy. Pressure areas, spina bifida, congenital T8 hemivertebral body. L5S1 slip, cause of pain, pars defect back here. L5S1 slip, occult spina bifida, incidental finding. T7 hemivertebra, young patient 21, need to investigate for other anomalies. Disc rupture will have radicular pain or sciatica, disc rupture. L1 MET, prostate cancer, need some radiation there. L1 burst fracture, 45-year-old, fall from a ladder. Fairly significant occlusion of the canal. Gymnasts are prone to pars fractures. Fracture L1 burst fracture, fall from a ladder. Retropulsional fragments will have canal stenosis, needs to have open induction, internal fixation. L3 fracture, L4-5 slip from pars defect, quite a marked slip there, 43-year-old may need stabilisation. Another 4-5 slip will need stabilisation of this. L5 crushed fracture, still got a roomy canal here, unlikely to require surgery. L3 burst fracture with decreased motor power in a 17-year-old. Marked occlusion of the canal here. He's a quadriplegic, still able to walk on a frame. T12 burst fracture from a dive, 19-year-old. T12 fracture from diving into river, 17-year-old. T12 fracture from diving into river. Disc-itis, decreased disc space, common in children. Infection, disc-itis, loss of disc space here in a child. L2 osteomyelitis, 3 weeks low back pain, staph aureus. Polio, curvature of the spine, also weak abductors, weak lower limb. Remember, sensation is intact. TB of the spine. L4-5 slip has been fixed in situ for instability and pain. L4 rattler, low back pain common in the community, excluding cauda equina, tumour infections and fractures. Low back pain at night, large abdominal aortic aneurysm causing it. OA L5S1 junction quite marked here. Spinal canal stenosis, severe pain, 8-year-old. Although surgery can give them relief, they may be reluctant to proceed. Lumbar stenosis here, quite marked narrowing of the canal. Schirmer's disease, angulation thoracic spine fixed, round back appearance. You get all the typical X-ray changes, wedging L5. You got 3 vertebral bodies wedged at 5 degrees and 3 adjacent vertebral bodies, Schwall's nodes. Scoliosis with left slipped upper femoral epiphysis. S1 injury apparent on the bones scan. L5 S1 slip in a 25-year-old. Asymmetrical creases, typical L5 S1 spina bifida with typical changes. Asymmetric creases with spondylolisthesis. Again, asymmetric creases. Spondylolisthesis L4 and L5. L4, L5 slip, L5 S1 slip. Spondyloloptosis where the spine has gone completely off the front of the sacrum. Look, it's right off. A myelogram is useful, MRI imaging is used now. TB of the spine, quite common developing world. ABC of the spine. ABC of the spine, apparent with myelogram. ABC of the spine seen on CT scanning. Lung metastases may be the first presentation of back pain. Low back pain, 3 weeks, 68-year-old. Big tumour in the lung, back pain's the first presentation. Abdominal aortic I hope that you enjoyed that. Thank you for your interest.